And so, without any further ado, welcome to the Heal Their Land seminar series. We're going to be looking during the course of these next few nights, we're going to be looking at major crises that are taking place within this beautiful country we call the United States of America. And we're also going to be looking at the simple solutions to these crises. What are the simple solutions? Well, let's look at some of these crises before we discuss them. First of all, how many of you are aware that we are today in the United States of America, in such an affluent society, in a major crisis in terms of our health and wellness? Is anyone aware of that? Yeah. Okay. Did you realize that there are many reasons behind this crisis, many factors that can come to mind? One of them is the economic side of this crisis. Did you realize that lawmakers are scrambling today to find solutions to the impending financial crisis that is occurring simply because of health care? Did you realize the Congressional Budget Office statistics show that by the year 2050, 70% of U.S. tax income will be used to fund Medicare and Medicaid services? Can you imagine the implications of such spending? 70% of all of our tax dollars just being spent on the individuals enrolled in Medicare and Medicaid services. And even now we're in major economic crises because of health. 60% of all personal bankruptcies right now are due to unpaid medical bills. 60% of all bankruptcies. And even by the year 2030, just a few years from now, 36% of U.S. tax income will be spent on Medicare and Medicaid. Why is it so expensive to keep healthy in this country? Here's a strange phenomenon. Here in the United States, we spend the most amount of money per capita on health care. Yet we have still some of the worst outcomes in certain categories, especially dealing with chronic disease. How do these things happen in a country that is so affluent, that is so blessed, that is so knowledgeable, that is so informed? Well, it's a sobering reality to consider some of these causes, but I want you to take a look at some of these stats first. 25% of Americans, let's say that we're constituting a picture of America, 25% of you here today will die from heart disease. 1/4 will die from heart disease. 40% of you today, or 40% of Americans, will develop cancer, and 20% of those 40% will die from cancer. It's a sobering reality that these diseases are so prevalent. 50% of Americans by the year 2025, just a few years from now, will be obese. That's 1 out of every 2 Americans will suffer from obesity by the year 2025. Even a few years ago, as of a few years ago, we realized that 27% of Americans are pre-diabetic. They're on the border to becoming full-blown diabetics. 27%. And if that's not enough, here's one more chronic disease to throw into the mix. In this current year, 130,000 people will die from a stroke. 75% of all spending in healthcare is on chronic disease, such as these listed right here. 75%. You can see why healthcare is so expensive. In this country alone, we spend almost $1 trillion for the treatment of the top 4 diseases: cancer, heart disease, stroke, and even chronic lung disease. Where can we find solutions to these dilemmas that face us? in this day and age. It didn't used to be like this, by the way. It didn't used to be like this. Coming on subsequent nights, we'll show you how the trends have progressed and we become increasingly more and more ill as a society. It's startling to look at these maps. But before we get too much into the depressing side of the crises, I want to show you a solution. Are you ready for it? Are you ready to see a solution? Well, I didn't come up with this solution. This was actually put together by the U.S. Public Health Service, which is just a few blocks that way. Okay, in 1994, the U.S. Public Health Service got together, experts from all around the country came together on this one topic of answering this question: how can we deal with the healthcare crisis that's coming on this country? That was back in 1994. And you know what they did? They formulated this whole list, this whole report. You can download it from the U.S. Public Health Service website. But I'm going to show you in a nutshell their concept to saving America, saving Americans' health. And that was this right here. They called it the ideal healthcare system. And this ideal healthcare system, any public health servant in the United States of America who has gone through their master's in public health and who's read Bernard Turnock's book, entry-level book into public health, has experienced and learned about this ideal healthcare system. Why is that? Because it makes so much sense. It's written about, it's published everywhere. And I want you to learn about it tonight. You see, the experts in the Public Health Service decided that if we put more resources into something they termed prevention and wellness or population-based public health services, then we would actually need to spend less money or put less resources into other types of health care. Now, could everyone see this right here on the screen? Depicted here is an area graph. And it basically shows a pyramid or a triangle that is stratified in different levels, with the base of the pyramid having the greatest amount of area. What does that mean in terms of resources for a resource graph? That means the most resources should be placed into this area, right? According to the experts here. And so they said if we put more money, if we indoctrinated more people into preaching health and wellness, less people will become sick. Does that make sense? Yes. That makes a lot of sense to me. That makes a lot of sense. Did you realize, I'm going to give you a few public health, primary population-based public health experiences right here, okay? Did you realize a study of over 30 or 50,000, I can't remember the exact number, of Americans was done in California, Southern California. They found that if adults would just drink, follow me with the cameras, if adults would just drink 5 of these 8-ounce glasses, 5 8-ounce glasses of water per day, they would cut the risk of a fatal heart attack by approximately 50%. I didn't hear a response from that. Wow. We've got millions of people dying each year from heart disease. Imagine the implications of more people drinking just a little bit of water. What would it do to our society? What would it do? It would save millions of people's lives. That's pretty simple, isn't it? Okay, what about proper exercise? What about proper diet? We know how these things can change people's lives. We'll get into some statistics as we close this session today. But suffice it to say, if we put more emphasis on prevention and wellness, we will solve many of the crises that we're facing right now. Why is that? Because let me take you up in the stratosphere here, so to speak, in the ideal healthcare system. You see, the experts realize that people are still going to get sick, even with some education. People are still going to get sick. So what else needs to happen? Well, yes, we need to put some resources into something we call primary health care. You need your primary, your family practice physician, your health and wellness individuals that you know and you trust you go to when the current crisis you're facing in health exceeds your knowledge base and you need a little bit more specialized help. Makes sense, right? It's nice to have a family doctor you know and trust, right? And so, yes, we need to put some resources into that. Tell me why the least favorite or least favored profession in medical practice is actually family practice and prevention today in the United States of America. I don't know how it's happened, but primary health care, primary care practitioners have become almost looked down upon by other types of medical practitioners. But we need to laud their commitment. We need to laud their commitment to our healthcare system. Moving up the stratosphere here in this area graph, we have something else listed. This is also known as secondary health care, or we can call it minor specialty care. What if someone gets a little bit more ill? Their illness develops a little bit more, even after visiting their primary care practitioner. Well, they might need a little bit more specialized care. They may need to go to a clinic. They may need to get a little bit more specialized care from a more specialized individual beyond their primary care practitioner. But this is not the most specialized care. In fact, the most specialized care, according to the experts of the U.S. Public Health Service, they deemed this was the least essential aspect of the ideal healthcare system. Why is that? Why is that? Does anyone realize already what I'm getting at, or what these individuals were getting at? It's a simple reason. It's because if you prevent illness, you have less people that need the cardiac bypass surgery. You have less people that need the angioplasty and stent placement for heart disease. You have less people that need these highly specialized, yet also highly expensive forms of medical care. Why is that? Because we educated the general populace to stay well. That makes sense, doesn't it? I can see why they called this the ideal healthcare system. But brothers and sisters, fellow Americans, are you ready to see the reality? Are you ready? It's actually completely upside down. In this country, we spend the very least amount of resources on prevention and wellness, and the very most amount of resources on the most specialized yet most expensive forms of health care. Something's backwards, and we're suffering the repercussions of it in our economy and in our health as well. I'll submit to you, the human lives are the greatest capital that we have as a country. You know, Winston Churchill once said that the greatest asset any country has is healthy citizens, or healthy citizens are the greatest asset any country can have. We have a tremendous liability then, because we're a nation of sick people. We need help. In fact, the average 75-year-old in this country today suffers from 3 chronic conditions. Many of these are debilitating conditions, and takes 5 prescription medications to manage those diseases. They're suffering. We have a suffering and sick population. Now, I told you I was going to mention a few more aspects of population-based public health services. We're giving some public health education right here for the next few minutes. Did you realize that a healthy diet is an important thing? How many of you realize that? Okay, we hear a lot today about diet and exercise and even stress reduction, correct? Why is that? Because we know there are implications against disease, well, in bringing about disease and encouraging the growth of disease. But did you realize that scientists are crying out, saying, why aren't we doing something? if we just made a few simple changes with our lifestyles here in America and even across the globe, but if we started it here, I'll submit to you, it will spread across the globe. But if we just made a few of these simple changes, it would have a profound impact upon our entire world. A few of these changes would be what's listed here on the screen. A recent study published, actually just last month, published in the Proceedings of the National Academy of Sciences Journal, found that if we just slightly increase the health of our diets, we cut down a little bit of the red meat intake, we reduce the fat intake to under 20% as a whole in terms of total caloric intake, and we started eating more fresh fruits and vegetables, the results would be cataclysmically beneficial. In terms of human lives, what they realize, if we just adopted the World Health Organization's dietary recommendation standards, we would save up to 8.1 million lives per year by the year 2050. 8.1 million lives per year. We're talking about millions of people's lives just by eating a little bit healthier. I heard an amen, and I would second that amen. You've heard of climate change, right? You've heard of global warming, you've heard of greenhouse gases, carbon emissions, all these technical terms. Well, I'll submit to you, a lot of people are questioning whether it exists or not. I'm not here to answer that debate, but what I am here today to tell you is that simply eating more fresh fruits and vegetables, according to these statistics here, could reduce total global greenhouse gases by 18% by the year 2050. Who thinks they can eat a little bit more fresh fruits and vegetables? All right, I think we could all move towards that. And even our environment will be thanking us because of this. And let's talk about the economic side of health and wellness. Some people say prevention doesn't pay. Well, I'll submit to you, it may not bring immediate rewards. I don't think anyone here is going to give me $50,000 or $60,000 for giving them that little tidbit of information about water, correct? But you would pay $60,000 for a triple bypass surgery. You would mortgage your house for it. But I'll submit to you, prevention pays in the long run. And prevention pays on the personal level. Here's an example of this. The same study revealed that if we just increased the health of our diets in a slight amount, we would save $31 trillion per year by the year 2050. How many of you would like to have $31 trillion? Okay? Well, I think our country would like to have a lot of that. We have the lion's share of per capita health spending. And so that $31 trillion, that would constitute a great help to our economy. And what do we have to do according to the research? Just start eating a little healthier. I want to challenge you today to make some changes. You may not be under the roof of your mother's house or under the auspices of your grandmother's watchful eye, but eat your Brussels sprouts. Eat your fruits and vegetables. They'll do you and this world a world of good. And don't expect to get all the information that you need in terms of health and wellness from your primary care practitioner. Okay? Why do I say that? Well, first of all, we're the most responsible person for our personal health. We need to educate ourselves, first of all. And secondly, a recent study published in the journal Prevention Medicine found that only 15.7% of all primary care visits in the United States of America included information on diet, exercise, and stress reduction. 15.7%. That's all. So the vast majority of individuals are not even getting any type of counsel dealing with how to stay well and how to prevent illness and disease. Do you see today why we're in a crisis? Is it clear to you that we're in a crisis? Well, I'll submit to you, we're not the first country in the history of this world to come into such a crisis. And there have been some societies that have had even much greater crises than we have had. But I'll also submit to you, we're headed in that same direction. Case in point, ancient Egypt. The Egyptian Empire was a great empire. In fact, it was one of the greatest empires in history, really. If you study the ancient writings, you find Egypt always played or exerted a powerful influence in that part of the world. Well, let me introduce you to the most powerful lady of Egyptian antiquity. Her name was Queen Hatshepsut, and she was, by all experts' accounts, the most powerful queen ever to reign in ancient Egypt. Do you know why she was so powerful? You've heard of Cleopatra, correct? You've heard of Nefertiti. You've heard of all of these other different Egyptian queens, but they had nothing on the power that this lady wielded. Why is that? It's because according to historical reports, this lady one day woke up and said, I am not going to be content with just being queen any longer. She went to some artisan and said, make me a beard. She put a fake beard on her chin. She stepped up on the pedestal of the throne, deposed her stepson and said, I am now a man and I am now Pharaoh of Egypt. She's the only female pharaoh in Egyptian antiquity. Now, she had to go against the current of society to do this, didn't she? But I'll submit to you, there were some things that she was struggling with that were far greater than the current of society in her day and age. You see, she only lived to the ripe old age of 50 years old. Why is that? Anyone know? Well, I'm thankful that we've found her mummified remains. And I'm also thankful that we have things like MRIs, magnetic resonance imagery, that we can put these mummies through and we can actually see what's going on inside, or what happened inside, or what were the causative factors in which brought about their demise. Now, this lady died when she was 50 years old, and this is the reason why. Dr. Howis, an Egyptian physician, did the study and he wrote the report. He said she had problems with her teeth and diabetes. She died at the age of 50 because of cancer. Why did she die? Because of cancer. She was losing her hair. She was overweight. Study goes on to say her face was full of wrinkles and she had a major back problem. The study goes on to say she had many other health problems. And she died at the age of 50. Does that sound like a nice way to pass away? Absolutely not. She was probably suffering in a tremendous way as she aged. But you know, the interesting thing about this is that Queen Hatshepsut was not alone. In fact, through studies of thousands of these mummified remains, what we found is that the average affluent Egyptian rarely lived past 60 years old. Many of them died the same ripe old age as Queen Hatshepsut, 50 years old. Why were they dying? Heart disease, stroke, cancer, diabetes, and obesity. Does that sound familiar? Yes. Let me ask you a question. Did you see that earlier? Yes. Where? In the United States of America. These are the major causes of death here in the United States. But I'll also submit to you that these individuals had some of the highest per capita healthcare spending of their time. In these affluent Egyptians, they had a marvelously advanced healthcare system. They had specialists, kidney specialists, the nephrologist of today. They had heart disease specialists, the cardiologist of today. They even had a complex system of anesthesia. They had anesthesiologists that didn't need to administer gases or ether as we used to administer years ago. You know what they would use? A very precise method of creating a slight concussion on the skull with a mallet. Now that sounds a little brutal, right? You want to go to sleep, you're going to have a physician come after you with a mallet. But in many cases, it may have been easier to recover from the little strike of the mallet than some of our new anesthesia gases. But I'll submit to you, even with all that complexity of medical practice, these practitioners were still not able to keep these individuals alive past 60 years of age. Why? Why did it happen this way? Well, in public health, sometimes what we do to answer one of these mysteries of epidemiology or health crises, we go to other groups of people and we see what are they doing differently. We know there were contemporaries to the Egyptians, and the most widely documented contemporaries to the ancient Egyptians were found in the Israelites. There's much recorded history dealing with these individuals right here. And the amazing thing is, many of these people, according to the biblical report, were contemporaries not only in time period, but they actually lived in Egypt for a certain amount of their lives. Now this is amazing right here. Joseph lived to be 110 years old. Now that number, 110 years old, shows up in the ancient Egyptian writing called the Ebers Papyrus. In the Ebers Papyrus, it's recorded that the ideal age in which someone could die would constitute 110 years old. So basically, if you died at 110 years old, that was the ideal. Some people say, I want to live to be 100 years old. Well, according to the Ebers Papyrus, you should want to live to be 110 years old. This is a common question. Well, why would I want to live to be 110 years old? Why would I even want to be 80 years old? Because I don't want to spend a number of years of my life in a debilitated state. I don't want to live in a nursing home the last 10 years of my life. Well, I'll submit to you, if you have that idea and you don't take care of yourself, you will spend the last 10 years of your life in a nursing home, and you probably won't live to be 100 years old. Because the choices that we make can either make you have a slow and easy, or not slow, fast and easy death, or maybe a slow, drawn out, and a death that's characterized by suffering, which is how many of our elderly are passing away. I spent quite a while working in nursing homes during my nursing career. And sad to say, I would not want to die that way. I wouldn't even want to live that way. It's a sad predicament. But look here at the biblical record. Moses lived to be how old? 120 years old. 120 years old, but did he spend the last 10 years of his life in battling some kind of dreadful disease? No. The Bible tells us he climbed up a mountain unassisted and looked out over and saw with undimmed vision the promised land laid before him. He looked out. He didn't even need bifocals or spectacles to see far or near. Okay? He had great vision. He had great health. And he closed his eyes, went to sleep, and went permanently to sleep. I don't know about you, but that's how I'd like to die. Anyone with me on that? Amen. Instead of spending 10 years battling some kind of chronic disease. Here's another one. Joshua lived to be 110 years old. That's the ripe old age right there that the Egyptians looked to as that ideal. What about Caleb? Caleb is a very interesting individual. The reason why is because we don't know what age he died at. We don't know. We just know he's a contemporary to Joshua, and so he probably was over 100 years old when he died, but we don't know exactly when. However, one thing we do know about Caleb is astounding, and is something worth notice. Because at the age of 85, this is found in the record, Joshua 14:11. At the age of 85, Caleb said this, I am still as strong today as I was in the day that Moses sent me. My strength now is as my strength was then for war, for going, and for coming. This man, this 85-year-old man, was requesting the most difficult battle, the most perilous journey in the conquest of Canaan, in the whole war. He didn't say, give me a back seat and let me just watch everything happen because of my seniority. He said, give me the most difficult battle. I know I'm 85 years old, but I'm still as strong today as I was in my youth. And you know what the interesting thing about this claim was? He was telling the truth. How do I know that? Because when Caleb went out with his band of men, those giants, the Anakims, could not stand in their way. They could not stand in their way. This man was not only interested in living long, he was a perfect example of how to live strong as well. And that's what we should be hoping to attain personally. Imagine the strength of a 45-year-old and an 85-year-old. That is astounding. So I'm getting ready to wrap this up. My colleague Kim will come up in just a moment to share some more very, very important facts. But I have to ask you a very important question before he comes up. What made the difference in these individuals' lives as compared with the ancient Egyptians? You might say it was their affluence. Well, possibly. That may have played a role. It seems like whenever a country gets more affluent, they tend to become a little bit more lazy, right? Because other people can do things for them now. It's not such a hard life, physically speaking. But I'll submit to you, it's more than just that issue. There is a secret that's been published for thousands of years that exemplifies the secret that these men held in common. And it's found also in the book of Exodus 15:26. And it reads, if you will diligently listen to the voice of the Lord your God, and do that which is right in his eyes, and give ear to his commandments, and keep all his statutes, I will put none of the diseases upon you which I have brought upon the Egyptians, for I am the Lord your healer. Amen. What were the diseases of the Egyptians? My fellow Americans, they're the same diseases we're dying from in massive numbers today. We need to go back to that secret, our very selves, and experience what we like to call, and what God would like to do, healing our land. Thank you.